Welcome to Dr. A's weekly Healthy Bastards health tip. Now this week's health tip is serious stuff. It's all about asthma. Now asthma is a disease of your lungs. Remember, you've got two lungs, just like your jugs, two lungs. And asthma more specifically is a disease of the tubes of these two lungs. Now let's just have a quick look at a set of human lungs taken from the Healthy Bastards health tip, just so that you can orientate yourself on what I'm talking about. And this describes the tubes. Now have a quick look at this. So here we have it. This has got his breathing tube, the trachea. That's the trachea, isn't it? The trachea is here.
That's right, Dave.
Yep.
Breathing.
And then when you breathe, the air goes down that tube and it splits into the bronchi, into the two lungs. So this is the right one, and that's the left one, isn't it? And then the tubes get smaller and smaller and smaller until they get to the little air sacs. See, that's like honeycomb, isn't it? And they're all the little air sacs. So asthma is a disease of those small tubes in the lungs that go out to the air sacs. Now have a look at this little picture here. What you'll see is a normal cross-section of one of these tubes. See how it's wide open and it's quite sort of thin, the wall. And the air flows in and out of there quite freely. But look at this one above. See this thickened tube? That's the tube taken from the lung of an asthmatic. It's thick and it's narrowed and swollen. And what happens is air doesn't have much trouble getting into the lungs, but it has a lot of trouble getting out through that swollen tube. And that's the essence of asthma, swollen, inflamed airways. You got it? Now asthma is very common in New Zealand. In fact, we have about the highest incidence of asthma in the world. In fact, they reckon about 20% of our children in New Zealand have been affected by asthma at some stage. And we can have some pretty severe ones too, particularly amongst Maori and Pacific Islanders. And you know, a significant number of people get it really bad, some bad enough that it actually kills them. So we've got to sort asthma out. So how do you know you've got asthma? Well, generally speaking, you cough a lot, particularly at night. You feel tight in your chest and you feel wheezy, particularly with expiration. So inspiration is no problem, but blowing out is hard and wheezy. If you go and see a doctor, what he'll do is he'll get you to blow on this peak flow meter. Every asthmatic should have a peak flow meter, all right? When they blow on it, a big huff, it should be way, way up here in the high bracket. That means that your tubes are wide open. If an asthmatic blows it and it's only low, then you know you're in trouble. And depending on the level, you should go and see your doctor or go to the hospital. But anyway, that's how you know you've got asthma. Cough, wheeze, and generally short of breath. So how do you treat asthma? Well, it's easy. You use either inhalers, where you put the drug in a little inhaler that goes down into your lungs, or tablets. But the important thing is, before you actually take inhalers or tablets, you need to know how severe the asthma is. And that's why this peak flow meter is so important. Because the level that you blow on this will dictate how bad your asthma is and at what point you should bring different things in. So say, for example, if you're just a little bit mild, wheezy after a cold, it's not a big deal. You blow on a peak flow meter and it's a pretty good peak flow, but it's actually just a little bit down. Well, then what you'd use is the Ventolin in the blue inhaler. See that puffy stuff there? The drug's in there. So you take a puff, either just put it in your mouth and take the big breaths, or you'd use a spacer and you'd put a couple of breaths in there and 6 big puffs on here. If your peak flow is even worse down there, then At some point, you need to ring the local medical centre or A&E. You need to have a crisis plan. If you've got, say, just low-grade asthma that comes and goes quite frequently, you might need regular treatment just rather than intermittent use of this. And these preventatives generally come in the orange inhalers. They're a little bit of inhaled steroid that you take in the morning and at night, and that settles down the lining of the tubes. Even more fancy, rather than just using a steroid one like this, you could use a mixed one which has a bit of steroid in it as well as a long-acting sort of blue one. But don't worry, don't get confused about this. The important thing is your practice nurse, the asthma educator or the GP will cover it. The important thing is knowing when to use these inhalers, and that depends on how you feel and this peak flow meter. So that's asthma, folks. That's this week's Healthy Bastards health tip. So make sure you keep in with your local general practice, and I'll look forward to seeing you next week. So help make this go viral.